Hello, everybody, and welcome to our Diabetes Australia Facebook Live question and answer session today on World Sight Day, which is wonderful because we are talking about all things diabetes and vision. So thank you very, very much for joining us, and we will wait and see as more people start to join. Today, I am joined by two wonderful guests. I have Naomi Barber, who is an optometrist, and she's going to introduce herself in a moment, and also Trish, who is going to share her story with us. So Naomi, hello. Tell us about yourself, please.
Hi, Renza. Thanks so much for having me. Happy World Sight Day. I'm an optometrist, qualified, working in Melbourne currently. I work for Specsavers, and I'm really excited to talk to you both about the importance of eye health checks.
Wonderful. Thank you so much. And yes, happy World Sight Day to you and to you too, Trish. How are you today? Tell us a little bit about yourself.
Hi, Renza, Naomi. I'm Trish. I've had diabetes for 45 years, so I'm a survivor, and it's great to be with you today.
Wonderful. Thank you so much. So the way that these chats work absolutely the best is for people to be as interactive as they possibly can. And so we would love people to be asking some questions, because that is the way that we absolutely get to answer all the things that is very pressing and on your mind. So I'm going to start with you, if you don't mind, Naomi. Let's talk about why it's important for people with diabetes to have their eyes checked.
I mean, there's quite a list of reasons, but really at the end of the day, when you have diabetes, you're at a much higher risk of developing sight-threatening conditions in your eye. In fact, we know about 40% of people living with diabetes will go on at some point in their lifetime to have a sight-threatening condition or a condition at risk of progression. So it's so vital to ensure that you're having regular eye checks and ensuring that you're keeping these things in check, and that we can preventatively treat these problems as opposed to reactively treat these problems when they crop up.
Yep, absolutely. So it's a bit of a, making sure that we're aware of what these things are and then knowing exactly what it is that we can do to try to minimize those risks. Yeah.
Absolutely, yeah. I think it is a good news story in that 98% of patients who come to us and who see us with even mild, even moderate cases of diabetic eye disease, they can be treated and the condition can at least be halted or in fact reversed, some of the changes that have occurred. So certainly regular eye checks are the key to ensuring that occurs.
Absolutely wonderful. So Trish, if I could ask you a question. What has been your, in 45 years of living with diabetes, how have you gone about making sure that you've kept up with your screening or your eye checks and eye screening? What's that look like for you?
I just have a calendar where I make sure I get my eyes checked at least once a year, but often it's more than that. Or if I notice any changes, the usual, the toes, the teeth, everything, I just tick them off as I check them every year.
Okay, really good. That's wonderful. It's good to have that sort of a plan. So Naomi, what's the biggest risk, I guess, when it comes to sight for people with diabetes? I'm so sorry, my dogs are going absolutely nuts.
They're excited it's World Sight Day.
I think they are. Yes, they are. So I'll ask the question again, the biggest risk when it comes to diabetes and eye conditions.
Yeah, I mean, Trish, you have such a story to tell, and I think it really, you hit the nail on the head with your message, because what we know is that in many cases, the early and even moderate progression of diabetic eye disease is completely asymptomatic. So you may not realise you have a problem until it's at a much more advanced stage and much harder to manage. So in early stages for patients with diabetes, you might notice as your blood glucose levels change, your vision might fluctuate hour to hour, sometimes day to day. And that is possibly the first sign that things are not consistent with your vision. Having said that, those changes can be very subtle and sometimes completely unnoticed. So the good thing is that in an eye test, although you might not feel any change to your vision, even very, very subtle changes at the back of your eye relating to diabetes can be picked up by an optometrist with ease. It's not an invasive procedure, not anything that we have to look too deeply into to see. It's quite a routine screening we do, and we can pick up these early changes. So important to get checked.
We're going to talk about what the screening looks like, because I think for people who don't know, sometimes they could be a little bit afraid that it is something that's quite invasive and a bit scary. So we will talk about that. We've got some questions coming in. Trish, I want to get to your story, but just give me one moment. I just want to ask this question because Naomi sort of touched on this. We have a question for Matt, who says he has type 1 diabetes and his vision changes from being blurry close up and then a couple of days later blurry in the distance. Why does it swap around like that, or why could it swap like that?
So there could be so many reasons, Matt, for those changes in vision. Certainly when you're seeing differences in blurred vision in different scenarios, I would be thinking, get checked. Now, it could be as simple as that you just need either an update to your prescription or a new prescription for glasses to actually correct that vision, those vision changes, and they're separate to your diabetes. But really, the important thing is to make sure that that's checked, because if it is related to your diabetes, to your blood glucose levels, important to ascertain that at this point.
Okay, thank you so much. Now, Trish, let's hear about what's your story. Tell us about your experience when it comes to diabetes and eye conditions.
Well, I was very lucky. I had an endo who used to check my eyes at every visit. He had, I don't know what it's called, the little black thing that they look in the back of your eye. And he used to just check it as a matter of course. And then one year, he decided that he thought he could see changes. So he sent me off to an ophthalmologist who did see changes and started me on thermal laser therapy. That was a while back, 1992. Mm-hmm. And I've had quite a bit of laser. And thank God I can still see, which, it was caught very early. So I'm very grateful.
So, Naomi, early detection is really, really critical. Early detection, early treatment, isn't it? Can we just talk about that? Why is that something that is just so, so critical for people?
I think that's paramount. I think what we understand from looking at the data, and actually what the KeepSight initiative is helping us to understand as well through the data, is that we know that many people with diabetes, many Australians with diabetes, are not having their eyes checked regularly enough, or in some cases at all. And the idea behind an eye test is hopefully that we see that everything is healthy, or if it isn't, even in the slightest way, we set you on the right track through a management plan. And optometrists, we only play one part in this. The GP is quite crucial. As Trish has mentioned, endocrinologists and other health specialists, we all need to work together to ensure you've got the right management plan. But the key really is getting checked regularly, so that any small early change can be detected and we can activate a management plan together for you. And that's really, it's the awareness about just getting checked regularly.
Yeah, one of the things that I've really loved that we've focused on in KeepSight, and we will talk a little bit about what KeepSight is in a moment, but one of the things I love is that we've really focused on the fact that when things are detected early, the outcomes are generally really positive. You said 98% before, and I feel that for so long, the messages around eyes and diabetes were really quite scary, which often, rather than motivating people, just makes us bury our heads in the sand, because nobody wants to have to deal with anything too scary and big. Whereas actually keeping up that regular screening is a really positive thing that we can do to minimize those risks. So let's talk for a minute right now about KeepSight before we move on. Naomi, what is KeepSight?
Oh my gosh. Well, I mean, it's the thing I think I love the most about it is it's a practical initiative. Yes. So it is an initiative that's just designed to make patients with diabetes, their life just that little bit easier. I think Trish will be able to speak to this very well, but there are so many appointments you're juggling as a patient with diabetes. There are so many things. Trish, you referred to your schedule, which I love. That's very organised. But you need to keep that up, because it is so hard to keep track of where you are with all your health professionals and making sure you keep everything in check. So KeepSight is designed to make your life just that little bit easier, to remind you when you're due for your eye test, and direct you back to your optometrist, to where you need to go to get checked. So it just takes one less thing, removes it from your plate, and makes life a bit simpler in that way. But I think the leaps and bounds that have been made with KeepSight, we've reached over the 100,000 Australians with diabetes registered onto the database. So that's 100,000 Australians who are going to be reminded when they're next due for their eye test, which is just fantastic.
Absolutely. And it's so easy now that you can just go into your optometrist and get it checked.
I completely understand. Yeah, absolutely. And I think that that's one of the things that I always think about diabetes. It's often it's so difficult, and it's just this constant list of things that we need to work through. I refer to KeepSight as a bit of a personal assistant. I know that it's only one aspect of my diabetes care. There's something is being made easier, but anything at all is wonderful. Now, we do have some questions come in. So Naomi, if I can ask you this, okay, can diabetes affect cataract development?
Sorry, was that cataract development?
Yes.
Yeah.
Yes.
It can. Yes. You can be at high risk of developing cataract earlier in life, and for it to progress more rapidly. That being said, almost everybody is at risk of cataract. So probably cataract is the least of your worries as a patient with diabetes. Diabetic retinopathy, which is what we call, the condition of the eye or the changes that occur at the back of your eye when you have diabetes. That's the thing, I guess, we are most closely looking for as optometrists when you come to see us.
Okay. All right, good. And now we have another question that says, my mum has diabetes. Is there anything specific that she should be thinking about or talking about to make sure that her sight is looked after? I'm going to start and say, please register for KeepSight. That's probably a good starting point. And we will put all the details for how people can register in the Facebook chat comments. So there will be a link in there that Emily will pop up. So if you haven't registered already, go and join over 100,000 other Australians, myself and Trish, I'm sure included, and register straight away. But what else can people be doing?
I think see an optometrist. Make sure you've got, as Trish does, a regular schedule. Find your local optometrist, go and see them, and go and talk to them about KeepSight. They can do the registration for you, which makes your life even easier. Do it on the spot while you're in the chair and you're being seen to. But it just starts you off with that good habit of you're in the chair, and your next scheduled appointment will be earmarked, and you'll be ready to go. Yeah. So it's certainly it's about those regular eye checks.
Yeah. And is that something for you, Trish, that obviously is very, very important, and it certainly has helped? So what does that look like now for you? How regular are you seeing your eye doctor or your eye specialist now?
I used to, sometimes I'd see him every 3 months, every 6 months, every 9 months. At the moment, I'm really stable, so it's once a year. And yes, it's funny, like you can go to the dentist and don't realise it's a year since you've been to the dentist. But I think with the KeepSight, that it sends you a reminder just in case you're not on top of it. I think that's brilliant.
I agree. And I love what you've just said there, Trish, because, your care is very personalised, and that's what we need. You've been needing to see your eye specialist when you need to, and it's so important that you're keeping up with that. So we have some more questions though. Does diabetes affect night vision, Naomi?
It shouldn't, not if your eye health is good. So again, it comes back to, as long as your blood sugar control is good, which really, as everybody online will know, is a massive factor in terms of risk for progression of any kind of systemic condition related to diabetes. Blood glucose control paramount, making sure that you're following your GP guidance on medication and on lifestyle factors, and of course seeing the optometrist. If you don't have any signs of diabetic retinopathy, if your eyes are healthy, you won't have any problems with night vision. But certainly, and as Trish can attest to, if you do start to incur damage at your retina, that can lead to troubles with partial vision loss in certain areas, perhaps peripheral vision, sometimes central vision, all sorts of different problems relating to how you see and how well you see and the quality of your vision as well.
Wonderful, thank you. Now, I actually have a question from somebody in Melbourne. Now, the three of us are in Melbourne, so we are all in lockdown, but somebody has specifically said, what are the rules at the moment for people living in Melbourne? Can we still see an optometrist? I'm assuming it's just like any other health appointment. We need to make an appointment and obviously make sure that we're not feeling unwell in any way, and then see our specialist. Is that right?
Absolutely, yeah. That's a really good question, and I would say probably something that is a bit confusing at the moment, especially if you live in Greater Melbourne. So certainly I can speak on behalf of Specsavers optometrists, but optometrists at large, if you need to see an optometrist, that is if you're scheduled and due for an eye test, make that booking and come in and see us. We are ready to see you. We're here to see you. And as patients with diabetes, you are high priority. Things that are let go, and if you're not making your scheduled appointments, you know, that can have quite dire consequences for you. So you're a high priority patient. Of course, we have all the COVID safe measures going on in store, and I'm not sure, I think I've managed to get everything out of view here, but we've got the screens in place, we've got protective wear, we're social distancing, we're keeping bookings spaced out so that we don't have too many patients in store at once, and we're abiding by all sort of the enhanced hygiene protocols as well in store to ensure you're staying safe as well.
That's so reassuring. Trish, how have you been during COVID? Have you managed to keep up with all of your screening, or have you not needed any in the last 6 months perhaps?
No, I've made sure I've kept up with everything. So I've made it a priority.
Yes, yeah, and I think I understand. I know that I had a screen scheduled. It was, I think, when we were in our first lockdown, and I actually called and said, you know what, I'm going to feel more comfortable. I'm on annual checks. I'm going to feel more comfortable. I haven't noticed any changes, just delaying this just by a month or two. And my specialist was absolutely fine with that. And then I went up. We were back in lockdown though. By the time I ended up going, I just thought, you know what, I've just got to get it done, because otherwise I'm going to start feeling very anxious and stressed because I haven't had the screening check done. But I can say exactly the same experience as you've just described, Naomi, of what you're doing. That was my actual experience of going in, and the safety measures were just so reassuring. Okay, so let's move on. Talk to me about what an eye check actually involves. So Naomi, I'm going to ask you, and then Trish, I'm going to ask you how you prepare for those checks. And I'm going to start though by saying I have an absolute fear and anxiety when it comes to eye checks. I absolutely do. I stress about it for a couple of days beforehand when I know it's coming. The thought of putting in contact lenses, which I don't wear, makes me really, really uncomfortable. So feeling this way is quite understandable for a lot of people, but reassure us by telling us what actually we can expect when we go to have an eye check.
I can totally empathize. I feel the same about the dentist. But obviously I'm biased. I love eyes. I think they're the most beautiful organ in the body, and obviously very important. Aside from the brain, probably the most important piece of real estate in our bodies. So, but very biased. I think certainly, and actually, Trish, you will be able to attest to this, and I'd be interested to hear your thoughts. But things have changed a lot with eye tests over the last 20 to 30 years. It is a very minimally invasive process at this point, especially considering, with patients with diabetes, you're used to a lot of poking, a lot of prodding, a lot of different assessments. I'm here to say it's quite a simple, streamlined, and not very painful process in terms of what to expect. Generally, the entire process from arrival to the point where you walk out is anywhere between 20 minutes and an hour. There will be a couple of key elements to the sight test. So the first is probably something that many people online will be quite familiar with. So that is the vision assessment. So that would be where we test each of your eyes to see how they're functioning, your level of vision, both with glasses and without, if you don't need glasses. And that's using that electronic eye chart. And that's also if you need a prescription, where we're checking the prescription and updating that accordingly. And quite key for patients with diabetes, because vision can change. And so it's important that we're comparing back to your last eye checks as well to ensure that you're still maintaining a good and healthy level of vision. So that's the first component. There often is a couple of other screening tests that go on. We check your pupils. We do a couple of other very key neurological screening tests to ensure everything is stable and healthy. And then the big bit, and the bit where we do our best work as optometrists, is looking at the back of your eye. And that's with a bright light. So there are a couple of bright lights, as those who've had an eye test will attest to. And we look in each of your eyes very carefully with a microscope and a lens. And that's to get a very, very good view of the retina, which is the back surface of your eye, to ensure that the vessels of your eye and the tissue of your eye is healthy. And that's where we detect even the very faintest, earliest signs of diabetic retinopathy. At Specsavers, we use something called an OCT as well. So an OCT is a 3D scanning technique, and this is gold standard technology and used by eye specialists as well. This is clever because it allows us to check the layers of the eye. So not only are we getting, an in situ view, or looking at the back of your eye with our own eyes, we're also getting, if you like an X-ray scan of the back of the eye, because some things can occur even without us seeing it. So tiny bits of swelling or little bleeds at the back of your eye related to diabetes that can be easily detected through that technology. So it's quite incredible. We've started using that technology for every patient, which has, as you can imagine, opened our eyes, excuse the pun, to a world of, vision related changes, particularly in the realm of diabetic retinopathy, that we otherwise would not have detected. So it's really helping us to have that paired with our examination. And that's about it. Then it's a big discussion, with you about your eye health, reporting back to you what we're seeing, making sure you're clear on what we've found, whether there's a change to vision, and then when you next need to come back in, which is quite key. And that's the point at which we'll then routinely register you to KeepSight to ensure that alongside our reminders, you're also getting the government reminder.
Wonderful. Trish, does that sound how your eye checks play out, or tell us a little bit about what your experiences are?
I mean, back in the 90s, that we used to have a fluoroangiogram to detect changes in the retina. But now I would say the most invasive thing is having eye drops put in. But it's really smooth, and the technology today is just brilliant. So nothing to fear.
Yeah.
And it's quick, it's easy, and it's just so vital.
Absolutely. Talk to us about the drops, Naomi, because I know that still, for a lot of people, they talk about how after if they've needed drops put in, that it's really bright going outside, they might not be able to drive, so they need to organise somebody to help them get home. Can you talk to us about when it's necessary to have drops put in and what people can expect from that?
Absolutely. Yes, thank you for reminding me. That is a part of the eye test for some patients with diabetes. So at this point, because the technology has advanced so much and we're getting so much of a clearer picture of the back of your eye, it depends on your situation as to whether or not you'll need eye drops. If you do need eye drops, they do sting just a touch on insertion when we pop them into your eyes. And the idea behind that is to open up our field of view in your eye for a temporary period of time. What that means is that your pupils are dilating a little bit, and so that means when you walk outside after your eye test, the glare can be quite overwhelming. So generally we do that if we're not getting a particularly good view at the back of the eye, particularly in older patients who might have cataract or other things going on that make it a little bit harder for us to get a view. I'd say you want to allow 2 to 3 hours for those drops to fully wear off, and definitely we will always caution you about driving immediately after an eye test. We recommend that you don't, and that you have someone with you and you bring sunglasses as well. Your optometrist will always advise before they put those drops in as to whether or not they're necessary, and then give you the advice around that. But I wanted to touch on something you said, Renza, as well, about feeling a little bit apprehensive about the eye test, let your optometrist know. We obviously do it day in and day out, but we will modify things and make sure we're explaining things really clearly to you and make sure that you're comfortable at all times. So please do let us know if you're not feeling particularly comfortable, and we will make sure we go out of our way to make you feel as comfortable as possible.
That's so reassuring. My eye specialist just thinks I'm hysterical because I'm generally such a calm person, and suddenly I'm all melodramatic. And I've been seeing the same specialist for 19 years, so he knows me very well by now. But he thinks it's quite amusing, just the theatrics every time. Now I have a question: is the visual field test not a standard diabetes test, or is it?
The visual field test is part of a comprehensive eye test for optometrists across the board, but it depends. Yeah. So the visual field test is essentially a test that checks your peripheral vision. So it's done on what you would think is a computer screen. There are bright lights that are flashed in your peripheral vision. You do it one eye at a time, and you need to basically press a button when you see the light. And the idea behind that is for us to get an understanding of the quality of your peripheral vision and the extent of your peripheral vision. It is used, as you can imagine, in all sorts of scenarios. So particularly actually as a test that we use to diagnose glaucoma, which affects peripheral vision. It will be performed on indication. So what that means is if you are displaying signs, symptoms, risk factors for particular eye conditions, or in Trish's case, if there are areas of your vision we think you may have reduced sensitivity in, we'll be performing that test to check that and to report back to the GP or to an eye specialist as well. And eye specialists will use the visual fields as well.
Okay, so just to the person who asked that question, if you're not sure why you're having it done, do ask, because there should be a reason why we have any sort of check or test done. So you always are very, very welcome to ask your healthcare professional, why are we doing this? Is this something that needs to happen? Can you explain why? And I think that is also, that goes towards being that reassurance, I think, for people to understand why and what the risks are and why we're having things done. So thank you for explaining that. Now,
it's also with your driver's license every year to make sure that you're safe to drive. So
actually, it's not a requirement unless specified by the healthcare professional. So I just actually was going to make that point. If you haven't had any issues with your eyes before, and your licensing authority in any state says you have to have this check, you actually don't. It doesn't say that in the guidelines, and that's a really important point, because a lot of people I know have gone to have their standard check for their medical for their licensing, and their licensing body has come back and said you need to have this check done, even though there was no indication for them needing to have it done. So that's one of those things that it's really confusing, and there has just been quite a lot of uncertainty around it. But the guidelines, which were very clear about it, Diabetes Australia, unless you have a health professional who has said that there are reasons why you need to have this done, it's not part of the routine screening required for a license. Yeah, so that's something to consider. Now, another thing that's really important, Naomi, is it expensive to have an eye check?
No, it's not. That's one of the best bits. You have to pay for anything good in this world, but you don't have to pay for an eye test, and it could save your life or your sight. So no, I can obviously only speak on behalf of Specsavers optometrists, but we bulk bill all sight tests to Medicare. We're so fortunate in this country to have a system that subsidises healthcare in that way. That covers everything. So I'm talking about the full comprehensive eye test if you need a dilation. So if you need the drops put in, the OCT scan comes as part of that at a Specsavers consultation, as does a visual fields test. So it's fully covered by Medicare if you're a Medicare card holder. So really important to keep that in mind. And the reason for that is the government really understands how important it is, especially for people living with diabetes, that these checks are conducted routinely. So, their investment is where their commitment is in terms of health outcomes for patients with diabetes.
One, love the bit of good news there, but also, look, and again, we're talking about any barriers and, people feeling anxious about having eye checks, and if it's expensive, it's human nature to sort of look for excuses for not to do things that we don't particularly want to do, because really they're probably not all that much fun in our minds. So it's great that this is one barrier that that is out of the way. So absolutely very critical. All right. So I do have a couple of questions around, okay, let's talk about what happens if it's been 3, 4, 5, 10 years since I've had an eye check, because these things happen. We have life, where diabetes is never going to be the most important thing in our lives, and things have slipped. We should, what do we do then? What's the plan? What should we be thinking about to get back on track?
I guess it's like forming any good habit. You shouldn't, it's never too late to start now. Yeah. So, and you shouldn't feel ashamed about it. Excellent. If you come to an optometrist, and we see this, there are many patients who have let it lapse for a number of different reasons, and some of them very valid personal reasons, other things going on in life. But if you're in the seat getting checked, or you're making that step to make a booking, that is the first step. Yeah. Once you're in the room, we will ask you many questions, all designed to give us an understanding of your risk profile for diabetic eye disease. And of course, if it's been a long time since your last check, if you've had diabetes for a long time, if you're having trouble with medication or blood glucose control, all those things play into how we then design the assessment for you. And we'll make sure you're looked after. And then once you're with us, it's going to be a lot harder not to come back routinely, because we'll get you onto the KeepSight database and ensure that you're reminded appropriately and in a timely way, and in a way that makes your next visit much easier.
Yes, but can I also add something else that's going to make your next visit a lot easier, is if the person who we're seeing has the attitude that you've just described. I can't stress enough how having somebody who is not going to shame and judge people, and understands that life happens, and it's about, okay, let's move forward. Okay, so maybe you didn't get your eyes checked, we get that, but let's talk about moving forward. So that would make me want to come back and feel more comfortable about coming back. So please don't ever underestimate just how critical that is. So thank you for being like that. I actually wanted to ask you about that, Trish. How important do you feel that that attitude from the healthcare professional is when it comes to making those appointments and having those screening checks?
Yeah, I think it's very important. One of the first questions they always ask is, how's your diabetes been? Yeah. And now I pull out my Libra Freestyle. Yeah. And show them my lovely graph. Sometimes it's lovely, other times not. But I mean, that's such a loaded question and can be full of judgment. So I sort of usually just pass over that and just say good.
I find that a really difficult question to answer too. I'm like, yeah, still there. How's your father? I mean, exactly. Yeah, or it's a bit of a tricky one. But yeah, I think you're right though, that there are loaded questions, and knowing how to having your response ready for that is often important. Naomi, we have a question that's just come in. Somebody says that their dad is 78, was diagnosed with type 2 diabetes 2 weeks ago.
Oh.
He wears glasses for reading, and he's had both cataracts done about 2 years ago. When should he next have a next eye check?
That's a good question. So it's very likely his optometrist will have put him on either a 1 or 2 year review, but it would be great to contact the optometrist and let them know that he's recently been diagnosed, and then they'll have a look back at his clinical records and make a decision on when he, perhaps if they need to bring that appointment forward for his next visit, or if they'd like to see him immediately, or advise. But always useful information for an optometrist if you're newly diagnosed and if it wasn't previously disclosed.
Yeah, absolutely. I think that's really great advice. And register for KeepSight as well. I know that we do we have mentioned KeepSight a lot, but just anything that's going to help us remember when to do one of those diabetes checks. There are so many of them. It's so critically important, and this is free to do. It literally, I can tell you, it is a 2-minute registration. It's keepsite.org.au, but Emily will have that available. You can just click on the link, and really it does take 2 minutes. It's not one of those things where you've got to give them bucket loads of information. It's really a super quick process. Now we're just about starting to think about wrapping up. So if there are any last questions from people, please get them in super quickly, and we will endeavour to get to them. So I just wanted to ask a little bit more about, I would like to focus just a little bit about people perhaps feeling a bit concerned about having eye checks. Because I know that that's often a real barrier to people not going and having that check. So, question for you, Naomi: what would you say if somebody came in, they've made the appointment, they've kept the appointment, they're sitting there in front of you, and they say to you, "I'm really anxious about being here." How do we have that conversation? What sort of things would we be talking about?
It's a great question, and I think it's something if we now look at the training for optometrists, so getting into what does an optometrist learn at optometry school or at university, more and more, especially in Australia, diabetes is obviously a massive health issue for Australians, and something that is definitely on the minds of health professionals. So we're very fortunate that within our training program, our focus on diabetic eye conditions is quite strong, but we've always got more to learn. So it's not just about us being the experts in being able to diagnose your condition, but it's how we talk to you about it and how we find out. As you said, asking questions that are very broad and sweeping might not help. We might need to be asking more pointed questions in a reflective way to get to the bottom of things. So I think at the end of the day, what anybody who's not that familiar with an optometrist or an eye test should think about is you're coming to see an expert who understands how diabetes plays into eye health and is particularly interested in ensuring that when you walk out, you're fully educated and aware of your risks. And we're here to help. We're here actually, we're most focused on ensuring that you have a good experience and that you want to come back next time, even if it's not the most enjoyable thing in your calendar, that you feel that you've got something out of that experience in terms of awareness, but also feeling in control of your own health. So I think that's the responsibility that lies with us, and that's what I think more and more optometrists are very aware of in terms of making sure that we're getting to the bottom of any particular concerns of patients, whether it's eye health related or whether it's actually related more to the process itself.
Yeah, wonderful. Okay, well, look, let's wrap up. I always like to wrap up with final words of wisdom. So, Trish, what would you say to people with diabetes who, they're due for a health check or they're thinking about this? What's your take-home message to people?
I think it's the most important thing in all of your schedule of diabetes care, and do not delay it. And the more you know, the more empowered you are to be your best self, to take care of yourself in the best possible way.
Yeah, wonderful. And Trish, thanks so much for sharing your story, which is I think that we often hear really scary stories rather than the stories that show that, the importance of screening and what the outcomes can be. So thank you so much for doing that.
My pleasure.
Naomi, thank you so much for being here. Thank you for being the sort of healthcare professional I adore and love, and I'm so lucky that pretty much all of my health professionals are exactly like this, and this is why we do keep going back even when we're terrified. What are your parting? It's not you, totally me. What are your words of wisdom?
I think Trish has really wrapped it up beautifully. It's never been a better time to take control of your own health. We're here, we're trained, we're qualified, and we're ready to see you, and we want to see you. And ultimately, as optometrists, we do not want anybody to end up with blindness or with a threat to their vision where it can be prevented. So we're wholeheartedly focused on preventative eye care, on educating you, and on making sure that you never end up with any vision loss related to your diabetes.
Wonderful. Thank you so, so much. To everybody who has been watching at home, thank you. Thanks for joining us. Thanks to the people who've asked questions. This will remain on the Diabetes Australia Facebook page, so please feel free to share it with any of your friends who you think may have missed it but may learn something from it. And please do register for KeepSight. It's going towards us having a diabetes personal assistant, which when you think about diabetes as being a full-time job on top of our other full-time jobs, anything that's going to make it just that little bit easier is something that I am more than happy to embrace. But thank you very much, and we will wrap up now. Thank you.